Diaper rash happens to at least half of all babies at some point. A lot of things can trigger it, but one of the biggest things new parents can do to treat diaper rash is actually very simple, and I'm going to show you in just a moment. Hi, I'm Dr. Teresa Wright, a pediatric dermatologist. I specialize in keeping kids' skin healthy. There are a few different types of diaper rash, but by far the most common is called irritant. It can happen if your baby is teething or has diarrhea. It's mostly from the skin being in contact with urine and stool more often or for too long. You'll usually see pink or red patches where the contact is occurring. This is true regardless of your baby's normal skin color. If it's very severe, you may see raw spots or open sores with bleeding. So how do you treat it? Number one, change those diapers and do it often. If access to diapers is a problem, please ask your pediatrician for resources like a community diaper bank. Number two, avoid diaper wipes that may contain irritants. At home, you can use warm water and a soft cloth or gauze to clean your baby. And when you need to use diaper wipes, try to choose one that is fragrance-free and contains very few ingredients. Number three, when you clean the skin, try to dab it and minimize wiping. Let the bottom air dry if you can, but don't use powders. Powder can be breathed in, and that is not healthy. Number four, and this is the big one I mentioned at the beginning of the video, use a thick layer of barrier cream. And when I say thick, I mean lay it on there like you are icing a cake. So this is how you want to put the barrier cream on. You want to take a lot of this cream and apply a very thick layer, like frosting. Think like you're frosting that baby's tushy. You want a really thick layer. So thick that when it gets dirty, you're just going to remove the top layer. And you really can't apply too much. You don't want to see the skin through this cream. You want only to see thick cream. The brand of barrier cream doesn't matter, but it should have a high percentage of zinc oxide or petroleum jelly in it. And of course, you should be sure to keep your baby clean with baths and try to keep their diapers a little loose, especially when their skin is irritated. If you find these tips helpful, please hit the like button. It helps this video spread so other parents can find it too. If things don't start to clear up in 2 to 3 days or your baby has a fever, it's time to call your pediatrician. There are a few other types of diaper rash that need special treatment. One is a yeast infection. Yeast will usually cause bright red areas and red bumps or pimples. Diaper rashes caused by bacteria can also have pimples, or you may see very bright red skin around the baby's anus. Rarely, diaper rash can be caused by an allergy to something in the diaper or other products being used on the skin. Babies with some chronic skin conditions, like eczema, may be more prone to diaper rashes. We have pictures of several diaper rashes linked in the description of this video down below. Please take a look and get details about the different kinds of diaper rashes and treatments from healthychildren.org. That's the parenting website for the American Academy of Pediatrics, so you know it's information you can trust. While you're there, don't miss the symptom checker. We'll link to that too. You can use it to look up your child's symptoms and get trusted information vetted by pediatricians from the AAP.